This is an installment of Staying Safe in the Hospital, a guide for older adults and their families.
Hello, I'm Dr. Jacob Walker, geriatrician at the University of Colorado.
And I'm Dora Chung. I'm a pharmacist at the University of Colorado Hospital.
We'll start with the story of Miss Brown. Miss Brown is an 84-year-old woman with a history of multiple medical problems for which she sees 5 different doctors. She presents to the hospital after a fall at home. She was going to the bathroom at night and unexpectedly ended up on the floor. She does not remember how this happened. Unfortunately, she has a broken hip and will need surgery to fix it. Her doctors review her list of medications, which they find to be a mile long. She does not remember the names of all of her medications, only that she takes 7 pills in the morning and 8 pills before bed. She's not sure what all these pills are for. She also takes some over-the-counter medications for constipation, headaches, and sleep. Here's her medication list on the right. Miss Brown is suffering from what doctors would describe as polypharmacy. Put simply, she is taking too many medications. Even if all of these medications are appropriate for Miss Brown's medical conditions, there are too many for her to manage on her own. Polypharmacy often occurs in older adults as they develop more medical problems, see more doctors, and receive more prescriptions. Over-the-counter medications, vitamins, and supplements can also add to the problem of polypharmacy. Though it may not seem like a lot, researchers consider taking 5 or more medications to be polypharmacy. Taking 5 or more medications increases the risk of making a mistake or even causing harm to the patient.
Being on too many medications can cause a lot of problems. Every medications come with potential for side effects. The more medications you take, the more likely you'll experience side effects. Sometimes medications are even prescribed to treat what may be a side effect of another medication. One common example is constipation that develops in patients taking opiates for pain. These patients would then need to start taking laxatives to treat the constipation. The risk of side effects are even more common in older adults who are more sensitive to changes in medication dosing. The risk of side effects also increases when we consider that many drugs interact with one another. An example is that taking a blood thinner with ibuprofen can increase your risk for bleeding. Polypharmacy can also make it very difficult to take medications as prescribed. It's very hard to juggle 10 different medications at a time, especially if these medications need to be taken in a very specific way or at specific times. This can be especially challenging for people with memory problems. To add insult to injury, taking medications can be very expensive. Being on a lot of medications can put a big dent in your wallet. Doctors also struggle with polypharmacy. It can be very difficult to know how to best treat a patient when you are not sure what medications they are already taking. It can also be hard to talk about what really matters to patients when you're lost in a sea of pills. It is important that your doctors know exactly what you've been taking, especially during a hospital stay. Every year, thousands of older adults are hospitalized for medication-related problems. We may not be able to identify the cause of a patient's symptoms if we do not know what medications they have been taking. This can sometimes mean acting like a detective. When patients do not know their medications, we often rely on family members to review what pills are at home. We'll also enlist the help of pharmacists to make sure we have the most accurate list possible.
Let's take a look at Miss Brown's medications again. During her hospital stay, the doctors and pharmacists review her list for accuracy. They call her local pharmacy to figure out what she's picked up recently. Miss Brown's son helpfully goes over to her apartment and brings in all of the bottles he finds at home. He finds that some of them have never been used, while others appear to be taken regularly but were not on her hospital list. Miss Brown is on a number of medications that may have contributed to her fall. She is taking 2 different medications for sleep that can increase the risk of falls in older adults. One of these was not even on her hospital list because it was purchased over the counter. She's also on 3 different blood pressure medications, though it is not clear if she's been taking all 3 of them. Her blood pressure has been low in the hospital, which can also lead to dizziness and falls. Armed with accurate information, Miss Brown's medical team can now make smarter choices about her treatment. They can also help prevent future falls and fractures by removing risky medicines. We call this process deprescribing. Hospital stays can be a great opportunity for deprescribing. This is when we stop medicines that are causing harm or are no longer offering any benefit. Deprescribing is best done with input from your medical team. It is not a good idea to stop medications on your own without first telling your doctor. This helps to ensure that stopping the medication is safe and that the medication lists are kept up to date.
When patients leave the hospital, there's a good chance that that their medication list will change. It is important that patients and their families review the medication list carefully with their nurse or pharmacist to make sure that everyone understands the goals of treatment. This is also a great opportunity to make sure patients will have a way to pick up their medications from the pharmacy when they leave. Many of the medication errors that happen around hospital stays occur after the patient has gone home and either do not have the medications they need or are not sure if they're supposed to take them.
So how can you help to ensure that your loved one is not harmed by polypharmacy in the hospital? First, it's important to make sure that their doctors have an accurate medication list. You may be asked to find out what medications your loved one has at home or verify that they've been taking what's listed in the chart. If you are not sure, that's okay. Second, it is important that you be present when they leave the hospital so that you can review any changes to their medications with the nurse or pharmacist. You may need to help pick up the medications from the pharmacy and discard unneeded or expired prescriptions from their home. Third, it is very important to fill all prescriptions at the same pharmacy. That way, the pharmacist will have all of your medications on file and can evaluate for drug interactions. Fourth, it is important that you or your loved one keep close track of medications outside of the hospital. It is helpful to maintain a written list of all medications they are taking, or to bring their pill bottles to every doctor's visit for review. This is especially true for people who see doctors in multiple health systems. Last, it is important to always ask questions. The more you know about your medications, the lower your risk of harm from polypharmacy.